Hi everyone, Dr. Brian Steiner here at Wilkins Spinal Care in Mount Pleasant, PA. So today we're going to talk about canal stenosis, or spinal stenosis is what they call it. Spinal stenosis, what it is, it's narrowing. That's what stenosis means, is narrowing of a space. If you looked at my blog today, you'll notice that I did a picture. It's nothing to do with health or spine or anything like that. You saw it was a road, a windy road, in a really narrow space somewhere deep in the woods. That's why I used that picture, because that's what stenosis is. So what type of patients, what do they experience with canal stenosis? Same thing that would be caused by a disc bulge or disc herniations. These patients are going to come back with low back pain, neck pain, depending where it's at. They're going to get numbness, they're going to get tingling, muscle weakness, they're going to get organ malfunction. Sounds very similar to disc bulges, disc herniations, right? So canal stenosis can happen for a number of different reasons. It can happen from bulging disc, herniated disc. It can happen from degenerative disc disease. It can happen from a trauma, or just as a factor of life. And what I mean by a factor of life is it can happen congenitally, like someone can be born with a small opening that can cause pressure on a nerve root. And I'll explain that through my spine, and I'll explain it through a drawing, because again, the drawings really seem to be helping patients understand these things a little bit more. So first one we have, central canal stenosis. So this right here is the spinal cord, okay? I'm not a professional artist again. So what happens is you have the spinal cord here. Whenever there's a disc bulge or a disc herniation, anything like that, it's going to press onto that spinal canal right there, which is going to cause that symptoms of numbness, tingling. So that's central canal stenosis. Foraminal canal stenosis. In order for me to explain that, I'm going to actually show you the spine here. I'm going to have my camera lady zoom in a little bit. Let's go to the lumbar spine, because these are a little bit more opening. These openings right here, they're called foramen. They are opening spaces that allows nerves and blood vessels to pass through. Now, whenever somebody gets degenerative disc disease or disc bulge of any sort, these narrow. And some people are even born with smaller canals here. What happens is the smaller they are, the more pressure there is on that nerve root. So here's what I'm going to show you on the drawing on foraminal canal stenosis. This is the opening here. Just say this spot right here, that's the spinal nerve. Okay, but say there's degeneration that comes into play. What's happening here, and obviously this is just exaggeration, there's narrowing of this canal here. You know, this will flatten and get shorter, and then it's putting pressure on these nerve roots, and before you know it, it's literally on that nerve root there, causing that pain. So how is spinal stenosis treated? In the medical field, injections, physical therapy, sometimes even surgery. Sometimes what doctors will do, they'll do something called a laminectomy, which will open up that space, releasing all this pressure on that nerve root, but then eventually it's going to keep swelling and it's going to come back. Now, a chiropractor is not allowed to diagnose someone with spinal stenosis unless it was confirmed with an MRI. There's no way of knowing if it's spinal stenosis without an MRI. You know, you could see it on an x-ray, but they want an MRI for confirmation. So they're going to do injections, they're going to do physical therapy, and sometimes people even need surgery. How do we treat it? Well, we've been stressing this a lot, and I showed you the other one, but I have this one here, and I have that one over there. Decompression. Decompression is the key to all this. We have helped so many patients with spinal stenosis. We've helped people with disc bulges, disc herniations, but this week we're going to focus on the spinal stenosis. What it's doing is it's pulling that, opening up that canal, and releasing pressure off of that nerve root. And because we're doing a treatment plan, your body will learn to stay in that position and it will open up. And after they go through the program, we continue to pull them in a maintenance program to maintain that opening and make sure that pressure's off that nerve root. So, a little less of a video today. I didn't go into as much detail like I have disc bulges, disc herniations. Is spinal stenosis common? Yeah, for the most part. You know, of our decompression patients, it's probably about 30%, 25-30%, and a lot of the other ones are disc bulges, disc herniations. But as you can see, there's a lot of different types of conditions that we treat with this decompression protocol. And one that we'll talk about next week is another one, and we'll discuss that a little bit more next week in the next video. But that's all I have for you. Again, a lot of information. If you have questions, please don't be afraid to reach out to me. I'll be happy to answer any questions for you. Comment on Facebook. I'll reach out to you personally. Not a problem at all. Otherwise, if you don't have any questions, feel free to, again, give me a call. But otherwise, I will see you guys in next week's video. You have a good day.